Right now, we've already had her cleaned off really well, and we've numbed her so that she can't feel anything. That's what the little white area is. She's got some blanching from the epinephrine that's in the lidocaine there. That's good because that'll help keep her from bleeding when we're doing some of these injections and treatments. And when we inject them into the area that we're trying to treat, it actually triggers the hair follicles to turn on and start growing and actually repropagate themselves over time. And to really make the body recognize that these cells are there, first we do a little microneedling in the area with the skin pin. And that creates just a little micro injury so that her body knows that there's something going on and needs to send all those mediators that are going to really help the hair to grow and continue to propagate. Now you let me know if anything is uncomfortable. This is just a little skin pin. Doing okay?
Yep.
And it's just little tiny needles. You can actually stop it so you can kind of see the tip of that, those little tiny needles. And those just go in under the skin and make this little micro injury, and you may see little pinpoint bleeding. That's what we want to see. So if you look on the side where we started over here, you can actually see that with the little pinpoint bleeding. That means we've done exactly what we need to do there. And that should be enough. And now we're starting to see it over here as well. Good. All right, so that part is all finished. So we're just gonna start right over here. Let me know if you have any problems or pain at all. Pressure. And we just inject tiny little amounts throughout the entire area that we're trying to really thicken up for her. So for this, we do not wash at all for 24 hours. And then you can go ahead and shampoo and go about your regular business. I am going to give you this little gel that you can put on the areas where I did the microneedling at bedtime tonight. And you can put a little bit more on in the morning if you want to. And then we'll start to see some regrowth of hair in about 3 months. We'll see the best at about 6 months. So it's pretty much as simple as that, my dear.
Wonderful.
So what we'll do is we'll get a follow-up for 3 months, and we'll do another hair analysis, and we'll do some pictures, and we'll see how we're doing. Sound good?
Thank you.
All right, you are so welcome.